Hi, Dimitri.
Hello.
I'm Lindsay. We have a lot to cover today, so we're just going to jump right in, okay? Today we're doing the ear, nose, and throat exam as well as the cardiac exam, which includes pulmonary. So if you have any questions, just let me know, okay? So I'm going to start with your ears. And first, I'm just looking at the anterior and the posterior of your auricles, as well as the external structure. And I'm looking for any lesions or drainage or any cerumen, which is earwax, and I don't see any, so that's good. So now I'm just going to palpate your auricles. Any pain?
No.
How about in the pinna?
No.
Okay. And the tragus?
No.
Okay. And your mastoid process?
No.
Okay. Good. So now I'm just going to use my otoscope. I'm going to look inside your ear. I'm just going to pull up and back on your auricle. And I can see the tympanic membrane. And it's intact. Pearly gray, which is normal. I also see the cone of light is about 5 o'clock. And incus and malleus are in place. Okay? Let's see the other ear. Okay. Everything is normal, and the cone of light is at 7. So now I'm going to test your acoustic nerve, which is cranial nerve 8. This is going to test your hearing. So what I want you to do is just occlude one of your ears with your finger. Good. And so what I'm going to do is say a 2-syllable word over here, and I want you to repeat it for me, okay? Apple.
Apple.
Okay, good. And now switch ears. Chicken.
Chicken.
Good. Cranial nerve 8 is intact, so that's good. So that concludes the ears. We're going to keep moving. Moving on to the nose. So I'm just going to palpate the external structures. Any pain?
No.
Okay, good. That's intact. So now I want to use my otoscope again. I'm just going to look inside your nose. Just tilt your head for me. I'm going to pull back on the tip of your nose. Good. I don't see any deviation or perforation of your septum. The mucosa and the turbinates are nice and pink. There's no erythema, swelling, or lesions. So that's good. Let's check the other side. Good. Both the same. So just want to palpate your sinuses real quick. The frontal and the maxillary. Is there any pain with that?
No pain.
Okay, good. So that concludes the nose. So moving right along to the mouth. I'm just looking on the outside. No lesions or dryness or cracks. Open your mouth for me. Good. The corners are clear. No sores or cracks. Good. I'm looking at your gums and your teeth, and I don't see any redness or swelling of the gums or any bleeding. I see a few repairs, but no missing teeth, so that's good. Your buccal mucosa of your cheeks is intact. There's no lesions. Your hard and soft palate look good. I don't see any lesions there either. So say "ah" for me. Okay, good. Your soft palate and your uvula rise in midline when you say "ah," and that tests cranial nerve 9 and 10, the glossopharyngeal, and the vagus nerves. So those are intact. Open up. Your tonsils look to be about a +1. There's also no redness or swelling or exudate on your tonsils or on your posterior pharynx. So stick out your tongue straight for me. Good. It's normally papillated. I also don't see a coating. You have, lift up. You have saliva, which is good. It means your salivatory glands are patent. And I also tested cranial nerve 12, the hypoglossal, when you stuck your tongue out. You can put it back in. So that concludes the mouth exam. I just want to move on to the nose. I'm going to start by palpating the nose. Preauricular, postauricular. I'm looking for any tenderness or enlarged nodes or any nodes that aren't mobile. So we're going to move on to the occipital, your tonsillar, submandibular, submental, superficial cervical, moving down the sternocleidomastoid muscle, the deep cervical chain, posterior cervical, supraclavicular, infraclavicular, and now I just want to hold on to your arm, and checking the epitrope there. Let's see. Good. So there are some other notes, but I'll check those later. So we're just going to move on to the neck now. And right now, I'm just looking for anything abnormal, and I don't see anything. I just want to start here at your sternal notch. I'm going to palpate up on either side of it to inspect the trachea to make sure that it's midline, and it is. I also don't notice any swelling under the carotid cartilage either. So I'm also going to palpate. I'm going to come behind, making sure that my hands are curved around the sternocleidomastoid muscle at the cricoid cartilage. And I'm going to press, and I want you to swallow. Good. Was there any tenderness?
No.
Okay, now the other side, and now swallow. Was there any tenderness?
No.
Okay, so when you swallowed, I feel the thyroid go up and down, and that's good, and that's normal. And now I just want to palpate your carotid pulses, okay? So I'm just going to palpate lightly. Just turn your head to the left for me. There we go. Good, it's present and about a 2+. Other side. Good, they're equal. Okay, so now I just want to listen to them, okay? So I'm going to do this by using the bell of my stethoscope. I'm going to palpate just to make sure I'm in the right spot. Okay, I'll take a deep breath. Good, okay. And now the other side. Good, and that concludes the neck exam. I didn't hear any bruise or which would be caused by turbulent blood flow, okay? So now I'm going to move on to the heart exam. So before I have you lay down, I just want to do a check for a heart murmur real quick, okay? I'm going to check the aortic first. I'm just going to put the diaphragm, my stethoscope, in the aortic area. And I want you to lean forward for me. Just lean, good. Okay, good. I didn't hear you. So you can lay on your back now. And I'm going to switch to the bell of my stethoscope. You can scoot back. So I'm just going to put my scope in the mitral area, and I want you to roll to your left. Roll to your side. Okay, I'm checking for mitral murmur, and I don't hear any. So roll back over. So I just want to check your jugular. I'm going to use my light so I can see it. Good, and I see it. So I just want to measure the sternal angle. So what I'm going to do is I'm going to go on your sternal notch here. And go down till I feel a notch. I feel it there. I'm going to measure to the highest pulsation. Yours is about 4 centimeters, so that's normal. So that just estimates internal jugular venous pressure, okay? So I'm just inspecting the chest of the pericardium. I don't see any heaves or lifts or anything abnormal that would indicate an enlarged heart. So I'm just going to put my hand on your chest, and I'm going to palpate for any pulsations or thrills. And I'm going to do this in the same way that I'm going to auscultate. So this is the aortic and pulmonic, and these are both the second intercostal space. And tricuspid at the left lateral sternum. And now mitral at the fourth and fifth intercostal. Good. So now I'm going to use the diaphragm here, and I'm going to just auscultate, okay? Okay, good. So now I'm just going to use the bell of my scope, and I'm going to go in the opposite direction, okay? So S1 and S2 were present, and your heart rate was regular, so we're just going to go back the other way. This is going to give me lower sounds. All right, good. So I didn't hear S3 or S4, so that's good. So now, apical pulse, I would check right here. And what I would do is, in the mitral area, I would hold my hand there for 60 seconds and actually count, okay? So now we're going to move on to pulmonary vascular. So now I'm just going to palpate the pulses throughout your body, okay? Checking to make sure that they're symmetrical and have normal amplitude, okay? I'm going to start with your temporal. Good. And now your radial. Good. Femoral. While I'm here, I'm just going to check for inguinal. I'm sorry. Okay, so those are good. These are your angle nodes.
Tickled.
I'm
Okay.
sorry. Okay, I'm just gonna lift and look for popliteal pulse. And while I have your leg up, I'm just gonna inspect for any arterial insufficiency or varus cavities, and I don't see any. So let me do the other one too. I also don't feel the pulse here, which is normal. You don't always do. Okay, and your dorsal piece and posterior tibialis. And I'm also looking for any edema, and I don't see any. So your pulses are equal at about a +2 throughout your body. And that concludes our exam today. You're not done.